objectives.
Right. So would you expect a therapist to be a little bit higher on the scale than just describe and identify?
At this stage, I would hope so.
Yeah. Also look at what they did. They had identify, identify, identify. And, having three all right, so keep in mind that we judge this based on how many hours they're going to teach, okay? So they requested a 5-hour class to do this, to do what they have here. How long do you think it would take you to do 1 through 4?
I would say all day.
Well, I mean, to identify them, though, would it take you all day?
Oh, yeah. Yeah, probably not to identify them, but.
Right. So if you had to do something a little harder with it, yes, maybe. But just to identify and describe, well, you could identify and describe these in probably an hour. And so the only application they have is apply information. And so I wrote them back and I said, just wanted to point out that, your 5 hours that you're requesting the objectives don't meet the time requirements. And I explained to them about Bloom's taxonomy. So this is what I got back. All right, so the first one was changed to examine the differences between fetal and newborn circulation and the impacts of transitioning from fetal to neonatal circulation. You think that's a little bit more, got a little more meat to the bone, so to speak?
Oh, yeah.
Yeah. So, I was pleased to see that they paid attention, and all I did was explain Bloom's taxonomy to them. Distinguish between the pathophysiology of cyanotic and acyanotic and obstructive cardiac lesions. Again, that's much stronger, much better use of their time rather than simply identify these things. Differentiate the interventions necessary to balance systematic and pulmonary blood flow in patients with a single ventricle physiology. Again, I was blown away that I don't know if it was just they weren't thinking about it, but once we pushed it back to them, they pushed this right back to us, and we were able to approve it. And then the last one is relate the information learned by participating in simulation scenarios. They could have probably done a little bit more and be more specific with that, but because I guess they could say compare and contrast the information learned by participating in simulation scenarios. My question to you is, how would they do that?
How will they?
What would be a good way to accomplish that objective?
By having different simulations to be involved in, that one might deal with the cyanotic heart while the other one's dealing with the acyanotic.
All right, but look at the objective. They want to relate the information. So what would be sort of a plan to get them to relate that information? How would you do it? Because this is a continuing education program, right? So you have to think, all right, you're going to have various different people wanting to participate at various different levels. And if you gave them a single assignment to work by themselves, would they do that as readily, or would they do better with some type of group activity?
Yeah, I would do a group activity like like a basic CPR kind of scenario, that kind of format, and just let them work as a group and assign roles.
Okay. And I think that's a good way to approach it. You can do, I wrote a lot in graduate school about groups of friends, which are a little different than just simply, in other words, you would actually allow people to group together themselves based on their relationships and, develop these skills. The problem with it is, if not managed well, it can lead to the weak students grouping with the weak students, the strong students grouping with strong students. And so it works for professionals, who are in a professional environment, because a little bit better than it does a student, say, a first year or second year respiratory program. But nevertheless, you as an instructor could, or a professor could easily structure it however you wanted to. And there's all sorts of ways to do it. Now, there's not one right way, but just get them talking. I think communicating is really important, and try not to let one person dominate over the entire group, which I always had a problem with. You probably have had that either, I can't remember if both of you teach, but I know you teach at some level. I know Lori does. So you sometimes have those students who want to take over the class, and other students just kind of, move away. And that's not good for the whole process, because everybody needs to be involved. All right, so I'm kind of getting the hang of this whole beautiful AI. I went ahead and purchased it because I'm going to use it with what I do at the board. For some reason, it's just easy to put together. And if you want me to, if we have time, I'll go ahead and just show you real quick how easy it is to drop something in and make a slide and move on. But what I really like about it, just to give you an idea, is let me get out of this real quick. Is that if I want to rearrange things, I can put it on this, and I can put it wherever I want to, however I want to, and so I can see it clearly. Which is PowerPoint, I cannot see those darn slides. This also encompasses the entire screen, which is another thing I like about it. And after last week, I finally figured out how to embed the sound, which I should have read directions. My wife was always getting on to me about, you should read directions. But, I'm a male, so right, I'm not going to read directions. I just like to find my way through it. Let's see, present from the beginning. And I'm anxious to use this at a conference just to see how it looks on the big screen. I think it would be I can show it in my conference room at work, but it's just a big TV. It's not the big screen. I think it would look a lot sharper. That's what I like about it. All right, so real quick, we'll just go through a couple of these, and then we'll just open up for questions. I mentioned last week ADDIE Design. Have y'all ever seen the ADDIE Design process?
No.
Okay. I think, you essentially have done part of it. You've done the gap. Oh, no, I'm sorry, you did the SWOT. And I prefer the gap and ADDIE. And the gap analysis is actually the first step in the ADDIE design. So there are a number of ways to get to the analysis section. But the ADDIE design is used in business. It's taught in MBA schools and all that good stuff. But what's really interesting about it is at every single step, you're constantly reevaluating what you're doing. And it sort of goes in this cycle of evaluation and reevaluation, and you're constantly improving. It's kind of like writing a paper, and you're constantly editing. So this is what it looks like. So we obviously always begin with analyze. And so there's a number of things in the analysis process that they want you to consider, such as, I also learned how to use the annotation tools today too. Let's see. All right, so here you have your specific things that they want you to analyze within this design. First is define the gaps, and that's where you get the gap analysis. Talk a lot about identifying the audience and determine who you're going to be addressing, which I mentioned last week. Moving on into design, we're doing identify objectives, right? And then now you're outlining the content. You're doing the creation portion of it right now. And then you're actually developing it by developing the content for your end product. And most of the time, you'll get, probably not in this class, but when you get to your capstone, you begin the implementation portion. When do you do your capstone?
Next summer are 2 capstones.
Okay. So at that point, you're actually going to be implementing whatever you're designing and developing. But that's why you have to constantly go back and reevaluate each of these steps as you move along to make sure everything connects. Because it's like writing a paper. You have an introduction and a body and a conclusion. You want to make sure your conclusion reflects what you started with. One of the things that I don't know, there's been a number of people who've written papers, and you read the introduction, you read the conclusion, and it's almost like 2 separate papers. Those 2 things have to connect through the body of the paper. So does your so does the design of your project. It's got to connect from end to end, and that's why there's this constant reevaluation. Let's reflect back on, am I designing according to what my analysis said, and is my development process creating the things that I need to move forward with implementation? Because when you get to implementation, you begin to do a survey, or you begin to collect your data. If that's not right, then you're going to have to start over, and that's not fun. and try to keep it as simple as possible. The more questions you try to answer, the more complicated it gets. So try to find that one main theme, stick with it, and move on. And I had one question in my dissertation. Took me 100 pages to answer one question.
Oh my.
Okay, so that's why you don't want to have 3 questions. you want to boil it down to one question. And again, it may be that you answer other questions through the process, but your main objective should be answered, and you could spend a lot of time on that one thing. So what you're doing is just becoming an expert in that particular topic. And then, of course, evaluations. Were your goals achieved? You conduct your assessment, review the effectiveness, define improvements, etc. These things are all going to be some things you will be able to achieve. You'll be able to get you'll be able to get information up to a point, but you won't be able to do follow-ups, because I'm assuming that by the time your capstone's done, you're not going to come back and resubmit your follow-ups, right? So, but if the goal is to create something that you can employ at work, then you can then follow up with it at work. And I think that would be a good way to look at whatever you're developing. All right, let's see here. Happens. Okay, it's not going to let me do that now. Oops, I got all this stuff. Okay, that's funny. I gotta erase all my. Let's see. How do I get rid of that? Well, I can use an eraser. I can undo it. And also last week I mentioned the SMART approach. Did this help at all? Where you think specific, measurable, achievable, relevant, time bound. These are all the things you have to consider with your project. Does this sort of acronym help you sort of focus? Because that's what it's intended to do.
I think it will when I get that far. I'm going to probably be stuck on this evaluation stuff that I have to work on this week.
Okay. Well, it's all about the struggle.
I'm actually a little stuck on the evaluation part too, because I don't know if I missed something or if I don't know. Kind of circle back a little bit.
When you say you're stuck on the evaluation portion, give me an example.
I just feel like I don't have enough background in it, and
Okay.
so I'm having to rely heavily on the textbook, which is fine, but I don't feel like I'm getting it right. So
So is your concern what evaluation tool to use?
yeah,
Okay.
the models, and I just, because I really hadn't thought that far ahead yet, and
Okay.
we don't really have any foundation, I don't think, in that.
All right.
So,
All right. Well, that gives me some good information.
but that's just me. I mean, and I've been kind of in a fog because I had surgery, and I mean, I had a long story. So I mean,
Right.
but I mean, I could just be out of touch. I don't know.
Well, and quite honestly, with that's all I've done for almost 30 years is measure things. And so for me, it's like, or evaluate things. So it's like, I see it from a different point of view because I've just sort of lived there. And, it's one of those things, once you get used to it, you kind of have to stand by how you're going to evaluate something and you go with it. But then sometimes you do have to change it. And so I'll put something together on, I'll dig into that a little bit and see if I can come up with some answers for everybody, because I'm assuming everybody else must be having a similar problem, especially if they don't have a background maybe in program management. Definitely would be a challenge. But this is another acronym, the RUMBA. I like that. Whether it's relevant, understandable, measurable, behavioral, and achievable, it's kind of the same. It's just a different way to look at it. We like acronyms in healthcare. And then, of course, what's expected. And this is really important because this comes directly out of your book. Who, what, under what circumstances, and how well. These are all important things to begin with, because if you don't establish who and what you want them to do, trying to evaluate it will be impossible because you won't know what to do to evaluate them. So I think if you've got the audience, you've got your objectives down, evaluation will be a lot easier, because then you can build your evaluation, or choose the evaluation that measures what objectives you want to achieve. And of course, pick the domains. And within the domains, we also look at the Bloom's taxonomy. Now, y'all seem to be getting the hang of the Bloom's taxonomy. Do you see the logic in utilizing the taxonomy now?
Yeah, I try to use that when I do objectives for my courses
Yeah.
previous to this. So
Good. Because I think it's kind of, it just seems so easy just to write an objective, but when you really start to think about, okay, where do I want the student to go? That's ultimately going to depend on, that's going to set the tone for everything you measure. Because if you say, well, I want them to learn mechanical ventilation, I've actually seen, by the way, objectives written that way. I want them to learn mechanical ventilation. There's a lot to mechanical ventilation, and to learn mechanical ventilation, or to develop the skills to implement mechanical ventilation in a critical care environment is much more specific, right? But I have seen that, and I look at my faculty's objectives and I would go, okay, you just want them to just learn it. What does that mean? And then what do you mean? I want them to learn it. And I'm like, well, you've got to identify what it is you want to learn. Where do you start? And that's why I think it's just so, and that's why you have to do, sort of build it based on, the other scale, kind of connect all the dots, so to speak. You have to start at the top. What is the mission, the goals, et cetera, and then begin building in a downward fashion. But then you have to go back and evaluate to make sure that everything you do at course level is in the chapter level, and at the course level into the curriculum level, and into the the programmatic level, and it just keeps building. Now, from the cognitive standpoint, this scale, gives you the verbs to use, but it's also the behavior you're trying to get them to address. So going to the evaluation process, if you want them to be at the evaluation stage, the behavior that you're seeking is assess effectiveness of whole concepts in relation to other variables. So in the example of mechanical ventilation, we want them to be able to manage the patient on a mechanical ventilator, right? So how are we going to assess that? What would be the evaluation tool? Well, it wouldn't be just how can they assemble, can they turn the knobs? It's, do they know the theory behind that, right? So can they justify their settings that they use on a patient, on a patient with ARDS? Or what, that would be more at sort of like the chapter level. But ultimately, you want them to be able to do that for every disease state, correct?
yes.
So what I like about this Bloom's taxonomy in the cognitive domain is that it gives you specifically what behavior you're looking for. And I think what we really want all of them to be able to do is critically think, right? Which is going to take them, they're going to be at the analyzing, evaluation, and creation stage to do that. So I think, if you utilize this cognitive taxonomy, it'll make it a little easier to develop ongoing objectives and identify the specific behavior you want to measure. And in the psychomotor domain, it's kind of a similar idea. The difference is, of course, what are they doing as opposed to how they conceptualize. So, and I'm going to pick one here. Let's go with, let's go with organization. In other words, do you want them in a mechanical ventilation course to be able to design a mechanical ventilation plan of care for a patient with ARDS? Well, that's great if, in fact, you want them to do that. But if they're a first-year student with the first course in mechanical ventilation, do you think that's going to be possible?
Maybe a simple design we might be able to start, but they're probably not going to come up with a complete plan.
Okay, so let's back down a little bit. So would they be able to maybe get to the point of revising and changing plans? Do you think that's possible, first year, first course in mechanical ventilation? I mean, yeah, you want them to get here, but do you think you could get them here? And that's the thing, you have to know your students, right? If you have a really good group of students, by the end of the semester, you might be able to get them up to that point. But realistically, you're talking about the entire group. At the very least, you'd want them to be able to what? Be able to demonstrate that they could assemble the ventilator, turn the knobs, be able to do all the basic stuff, because before they can make a decision with the cognitive domain and actually physically go in there and make those changes based on what they know, they really have to have control of all of these mechanisms down here. In other words, at the beginning, what I used to do with my students, and you might have done this with yours or some of your staff, is I simply I go into the lab and I would just turn the ventilator on and I'd start turning knobs to show them what things did, and then I would just let them play. I would just simply let them play with it. If they get their hands on it, in many cases, I know we can call that kinesthetic learning. What it does is it gives some realism, though, to what they're doing. If you're talking to them in class all day long about the ventilator and they never see a ventilator, they're going to zone out in about 20 minutes. So think about where you are along this scale with any staff member or group. Now, for staff members, you would expect them to be at the higher level of physical psychomotor domains, right? For a student, you're looking at perception set and guided response at the beginning, and then maybe moving to the mechanism and then the overt response that they can actually perform it independently with a little bit of maybe bump them a little bit. Say, okay, what do you do now? Type thing. It just depends. And then
what about with patients? So that's where I'm kind of getting.
Okay, so it's a good question. Because with patients, you are not going to get to the higher level of the psychomotor domain, right? But what do you want them to do? What do you really want them to be able to perform or assemble their equipment that they need? Maybe it's a CPAP mask or whatever it is. You can easily show them how to do that and manipulate it, right? And apply it appropriately. And so that's the level that you have to get them to, but you also have to get them to the level where they're demonstrating that ability. So don't expect them to get up to the organizational level where they're able to, although, patients over time probably get better at doing what we do to themselves than we do. But that's not all of them. Most of them, are very, very reluctant to stay with something if they don't understand it. So you've got to get them to that mechanism level, if you will, in the psychomotor domain to be able to demonstrate and execute their care plan, because ultimately you're going to give them that care plan. How you do that depends on the patient's abilities, right? Their understanding, and so you got to kind of dig down and figure out, where are they now? What I like to say is meet them where they are. And one of the biggest things that can happen with a patient is when you do your first. When I used to do, or when I was doing my internship for whole health education, it would take me 2 hours per patient to get to where we needed them to be to understand what they wanted to learn. And then we would organize it so that we were getting them to the point where they could take over their own care. And what was interesting is I had one patient who we started out with the very basic stuff, and as she learned more, she became more interested, and she had really severe asthma growing up all of her life. And she had never been told about the asthma care plans and how to manage your asthma and all the variables that come in. And these are adult patients, so I was just working with adult patients, not kids. It's a little easier, I think. And we were able to change her whole mindset about how to manage. In other words, she didn't realize she had control. She had just given control up to the healthcare system, and the healthcare system failed her. So we designed a care plan for her based on what she wanted, which made it a lot easier than to try to force something on her that she didn't want. So we started out with just I got her attention with some information about asthma in adults. And after about 8 weeks, it takes that long, 2-hour sessions. After the end of the 8 weeks, she was feeling so much better but her medication regimen, she had actually decreased her medication. A year later, I ran into her, and she had stopped all of her medication and had not had an asthma attack since. So I asked her, what changed? She said, well, I learned how to manage my condition and not just rely on the medication, but to understand what triggered everything. And I was blown away, absolutely blown away. But it really doesn't come down to, what type of piece of paper you can hand them so they can manage their disease. You have to really engage them. And that's a process that's difficult to teach somebody in an hour. You can't do it. It takes months to learn. And I was so thankful I had that experience because, honestly, being in healthcare all those years, and I was frustrated just like you are. I was like, well, how do you get patients to really engage and really take command of their healthcare? And I can tell you, it takes time, and it takes somebody with an interest in teaching the patient what they need to learn, not what we think they need to learn. And that's the difference. In healthcare, we sort of take this cookbook method of, well, this is what you need to learn about your disease. We're going to go through all the steps. Well, the first thing, what we should change that whole concept and say, let's talk about what you already know. And we go right into the, right into their care plan then, because if they can tell me about their disease, I don't need to spend time on that. If they can't, I can spend time on that. It was just such an engaging process that, but you know what the biggest problem was?
What's that?
Time.
Well, time. Well, I'm actually going to be doing this on my days off, just because I won't have time with my assignment.
Right.
But more specifically for this discussion post, for the evaluation, because I'm going to be evaluating both data that I collect from all my questionnaires and individual evaluations per patient. Mm-hmm. So I wasn't sure what you want me to put there. I mean, because they're two totally different things for evaluation of data.
Well, sure. And so the first set of data that you're collecting is a survey, or is it your evaluation of the patient?
Well, it's a questionnaire, but I'm going to use that tool as kind of digging deeper into what they need.
All right, so you got two tools. Tool number one is a questionnaire. Tool number two is what?
Well, I want to provide information to the administration of this is what, these are the gaps that we need to address.
Okay, but who's filling out those questionnaires?
The patients. Well, with my help.
All right,
so it's going to be more like an interview / questionnaire.
All right, gotcha. All right, so here's what I need to do. Do you have those? Do you have something, a sample you can send me?
Yes, I do.
Okay, because it would be easier. I could probably, the bottom line is if you have two sets of data that aren't necessarily connected, but it sounds like you're saying they're not connected, you can still evaluate them independently, and then is there any correlation in the responses they get on a questionnaire versus what you did on an interview, for example?
Well, I just felt like it was going to be kind of useless just to hand them a questionnaire.
No, I agree.
Versus sit down and use those questions to kind of open up other doors to where their actual problems are.
Okay, so your evaluation is going to be a formal interview. And in that interview, you're going to be determining, based on the responses, whatever your objective is.
And I want to take that opportunity to provide education where they need it.
All right, so here's the thing. In the first time you do something like that with a patient, you want to avoid providing education.
Okay.
You want them to know that you're hearing them, you're listening to them. Because if you launch into education, then without getting the full scope of what in other words, you kind of want to sit back and really engage them and let them, tell you things that they probably you're not even asking, because that's going to be enlightening as well. So, but you have to kind of resist that urge of being the leader and allow the patient to lead you during the conversation to some degree with your assistance, And based on your questions you send me, I can give you an idea of how that would go. Okay?
Okay. Got it.
All right. So with the affective domain, now this is something that, certainly with patients or students, our staff, that, we should, look at very carefully. And quite honestly, I know Laura has, Christy, have you ever evaluated students or staff on affective domain?
Yes, I was an unofficial educator for my department for about 8 years, so I do have experience with that.
All right, good. So this is the hardest thing to evaluate. It's also the hardest thing if you have to, I guess you could say, deal with a student. If their psychomotor and cognitive skills are good, a lot of times educators will simply ignore the affective domain and say, well, they'll be able to communicate. But this is the most critical one of both, because I don't care what they can do and how well they can think, if they cannot communicate, they are going to be poor practitioners. If they don't know how to express themselves in a way that is professional, show concern for others, if they can't balance things between, doing something that is appropriate or inappropriate, or within a group staff organization, you see where I'm going with this. Is that, and of course, what I see on my end now are violations of the affective domain almost 90% or more of the time. And it comes from starting out with very bad habits, because in school, oftentimes, they are not really pushed on the affective domain like they should be. I had a reputation for dropping students out of my program for behavior. And I kept getting questions. And I don't take pride in that. But I was not going to let a student treat other people poorly and get away with it. And so I had it set up where we would make sure that we had the evaluations so that they all aligned independently. So if we had to make that decision, it wasn't one person making that decision, because you can get in a lot of trouble with this domain. But it's one of those things where you have to take it super seriously. And, if you're talking about a patient, obviously it's a little different, because you can't really force them to be professionals, obviously, but you can, look at this and say, you want them to behave in a way that's going to be beneficial to their health. Because if you start noticing, for example, they're doing things the opposite, they're getting engaging in risky behaviors, smoking while they're using oxygen, something like that. This is the kind of behaviors we'll avoid, obviously. But they may be doing that because they're frustrated or whatever. So it's a little different with the patient. But with staff and students, I can answer this 100%. If we don't start when they begin in the profession, it will come back to haunt you or them in later in their careers. And matter of fact, I was telling you when you came on that I was working on consent orders today. And the consent order is what we issue when somebody has violated the Practice Act. Every single one of them had unprofessional behavior involved with whatever they did. Now, technically speaking, it would be impossible not to, because you did something you weren't supposed to. But every single one of them had some pretty egregious unprofessional behaviors. Most of them came down from not communicating. And to give you a good example of that, 2 practitioners simply walked out of the hospital and did not provide report. Although they did communicate to the supervisors prior to the shift that they needed to leave, but did not communicate to the to supervisor before they left that they were leaving. They just put their workload on the table and walked out. Now that's pretty bad behavior. But those are the kind of things that if gone left unchecked, is a real problem. So I think we've already talked about this, but this is sort of where you might start. You give your guided instruction. You could switch around and say you want to have a group discussion, group exercises. I mentioned earlier that I allowed my students to go in and just make all kinds of mistakes, have fun, not worry about what happens in real life. Now, we would eventually bring it down to that, but once we did what I would call the fun things, they were more interested in learning how to do it correctly. And one of the most interesting things or experiences I had were with my medics from the Army that would come in. Because we live in an area where we have a military base, sometimes we would get at least one medic each year coming in from the Army or Navy. And so one year I had 3 medics. And what was really interesting is they were the best students at performing psychomotor skills, but had the most difficulty with the cognitive portion. They eventually got it, but once they got it, they all told me one thing that was pretty common that I used to see, when I talked to others who had that same experience, is that now that they know what they're doing, it frightened them. And it frightened them because now they know what they could do to harm somebody. And I found it kind of interesting at first, but I thought, that makes sense, because they were just simply given orders and they followed orders, and they did step 1 through 10, and it worked out or didn't work out. And, they weren't having to worry about the physiology behind it. But they said, now I'm more concerned about what I'm doing, and that's making me second guess myself. And I told them, I said, look, that's good, because if you are second guessing yourself, then that means you're thinking harder about what you're doing and not just simply following blindly. You should have some degree of apprehension before you make a move. Not to say that you want to be so apprehensive and not move at all, but I mean, I think both of you would agree that having a little bit is important. But adults really want to learn that way. They don't want to just, they don't want to just sit there in class. So this is Cagney's 9 learning steps, if you'll call them that. And in this particular, I don't know if it's in your textbook this way, but this just kind of gets you from step 1 to step 9. The first thing you do, we were reflecting on that just a minute ago with that graphic, gain the attention of the students. Do it the way that you want to do it, but you want them to focus their attention on whatever you're doing. And you could use that with the patient as well. Inform students of the objectives. And I drive this home, drive this home, and drive this home. If you don't have your objectives in order, measuring whatever you're doing is going to be impossible, because trying to teach somebody something without them knowing what you want them to know, it's like flying blind. It's like going on a trip without now it would be GPS. I used to say it's like taking a trip without a map, but now it's GPS. But anyway, stimulate recall of prior learning. So they want some context to what you're doing, right? So how will you do that? If you're working with a ventilator, it's pretty easy. You can start giving them some basic scenarios, and then get into presentation of content. So this is really kind of like flipping the classroom. In other words, in a different way. So and stimulate recall of prior learning, sometimes it may just be things you've already talked about related to it, not necessarily that you've done mechanical ventilation, but maybe something related to that. Oxygen therapy, for example. Providing learning guidance, elicit performance, provide feedback, assess performance, enhance retention, and then you start all over again for the new topic. But these are the 9 stages that you can work through. And basically, this is what we have here in this graphic. Various different ways to get to that end. It's not one size fits all. And the other thing is that when you look at what we're doing here, think about your learning styles. Does this hit a large number of learning styles?
Yes.
Okay. So if you've got somebody who's a kinesthetic learner or somebody who's an auditory or visual learner, we know that we can't just pinpoint and teach to that one student or 2 students. We have to hit everybody. And so that's why sometimes individual group exercises might work over, say, a group discussion. It really just depends on how it works. But if you give them all sort of the same experience, they will glean something from it. And that's our job, is to make it where they can do that. And I think, I can't remember who, neither one of you are doing a skills fair in your project, are you?
I'm not.
That's right, right. And in a skills fair, that's kind of what you're doing is kind of this whole type of process all the time. That's why I like skill fairs. What's that? Yeah, skills fair. We used to use them a lot for different things. We even did that for our health and wellness days for the community, and it worked. It worked great because it gets people excited about learning. You don't spend a lot of time at each station, but you can repeat the station and kind of settle in where you're most comfortable, and then move on. We used to do this all the time, and we would have a blast. And students really got a lot out of it. Okay, let's see. All right, so this is another way to look at Cagney's methodology here. So this is another graphic that I found that I thought was interesting. So it gives you sort of cues, like, hey, you get their attention. Today we're going to do what? And I think, again, at the beginning of every class, you really need to or every continuing education program, or certainly with patients, you need to broadcast to them what you're going to do. And then you kind of move up the scale from there. I kind of like this because it gives you prompts to what you need to do. Like you need to provide feedback at this point, after a period of time. And for us, let me give you an idea of how you might do that with a patient. So let's say you're interviewing that patient, Christy, and the patient's telling you a lot of things, and the best thing to do once they've gone through a couple of things is to paraphrase back to them what they said to you, and that's providing feedback to them. That feedback then can inform them that you're listening to them, and they're more willing to trust you that you're going to help them. So sometimes these very basic things are really important for patients. But it's important for staff and students as well. You just don't have as much time with staff that you say might have with students or maybe a patient. Staff seems to, I know I read in a couple of papers, there's staff, they get sort of in that zone and they don't want to be bothered. And, you really have to, in some ways, have to really get their attention a little bit more because, they don't want their time wasted, and they see continuing education as wasted time in many cases. I see this at conferences, and I hear this at conferences, and I get personally blamed for them being at the conference. And the reason for that is because when I started with the board, we changed our rules to mandate that they get direct interaction continuing education credits, and there's a reason for that. That direct interaction gives them that ability to sit back and talk to other people, but also the purpose of continuing education in our field is to do what?
Improve their quality of life.
Right. So our law specifically states in our state, it must advance the practice of respiratory care. So sometimes, and occasionally, not always, we'll get a continuing education request for people to learn how to set up oxygen therapy, nasal cannulas, venturing masks. And, I just, nicely say, well, this would be something great for a yearly skills evaluations, but it doesn't really advance the practice unless you're teaching them some new technique of oxygen therapy. But seriously, we would have that a lot. People would try to pass by arterial blood gases as a continuing education credit. And our committee is a volunteer committee, and they always catch that. They're like, well, wait a minute, this is just a basic skill. We can't approve something because they should know how to do that. And what they were trying to do was get in their skills assessments and get continuing education credit for it. So we figured it out, and so we just reject those almost constantly when we see them. Again, it depends, because an example of one that does advance practice but is also a skills advancement would be ECMO training. So if somebody goes to Duke and starts up the ECMO program, well, we give them credit for their initial ECMO because obviously that's advancing practice. But if they came back to us and wanted to do their annual skills test, no, not so much, because then it becomes what's supposed to be routine. And what's routine isn't necessarily going to be advancing practice. But if it's with a patient, of course, you want to advance their understanding of their condition and how they can manage it. So I think it's important to always remember that provide them feedback, and that feedback may be a little different, but nevertheless, you have to provide them that feedback. And then if whatever you want them to have them do, whether it's, manage their asthma better, their COPD better, be able to, do their CPAP, whatever it is, whatever that goal is, you have to assess that. They also have to assess it as well. Now, of course, patients, we don't worry about the job issue, but we would, for a student, we would say, okay, now this is how you're going to use it in the real world. And so again, this is just another way to look at Cagney's model. I think probably this is just as easy to look at and figure it out, but just everybody sees it a little differently. All right, so just wanted to kind of give a brief overview of that. Any questions that you have specific to your project, feel free to bring them to the class. But what I'd like to do is be able to, Christy, next week, if you'll send me those things, and if you don't mind, maybe we can incorporate them into class at the beginning, if that's okay with you.
Yes, I'll do that.
Okay, great. Well, do you have any questions, Lori?
The only question I have about the evaluation for mine, so my project for this class is just kind of a portion taken out of my survey
Right.
that I'm doing for my capstone. And we have to do a pre-assessment and a post-assessment.
Mm-hmm.
And so I kind of envision that to be like a pretest of what do you think a bachelor's degree can do for respiratory, and then after the initial presentation, they would do that same thing.
Okay.
But then I had that culminating activity where I want them to devise their own goal-setting plan for their professional future. Like, what do they see themselves doing in 10, 15, 20 years even?
Mm-hmm.
Do they want to do a bachelor's degree program or even go on to a master's? Do they want to stay bedside practitioners, or do they see themselves going into education management? Kind of devising that professional plan for themselves.
Okay. So what's your question exactly? How to do that?
Well, how would I evaluate their professional plan?
Well, it really depends on how you do. If you set your pre and post test up more like a survey, in other words, you don't have to be the exact same questions, but let's say, for example, in the pre-test, what would be a question that you would ask?
Well, I might ask something like, which of the following job would you need a bachelor's degree for? Something similar to that.
Okay. So in the post-test, I'm thinking, obviously in your presentation, you're going to be covering the things that you want to kind of gear them towards. So the post-test, you should get the answers you think you should get. And I did something similar to this every year as part of our orientation for our students. I would go over beyond the jobs that they would typically see in respiratory care. I had a whole PowerPoint presentation and what kind of degrees they would need and additional training they would need to do that, to sort of garner their interest. So I guess the first pretest is going to be about assessing where their interest is. And then after hearing the presentation, you want to assess, now where is it? And you could easily set it up where you're really measuring the same things, but maybe doing it a little differently. I'm trying to think of the best way to set it up, but you want it to parallel. So when you compare pre and post test, you can see that maybe you've changed their thought process about what they wanted to achieve. So that means your presentation would have to cover the things that, and I'm assuming they would, cover those topics that would pique their interest, get their attention, if you will, and then sort of start shifting the mindset towards, I want to become an APRT, I want to get a master's degree and work in case management or whatever it might be. So I think it would be, we call it a pre and post test, so I think it would be more like a survey. pre and post survey style. I just don't know if you want to, how you want to set that up, because anytime we create something, we have to think, how are we going to validate that, okay, so how are we going to validate what you're going to teach them? You want to know, one, what they know, you're going to teach them, and then you want to find out how that shifted their mindset. So I think what you do is start out with your objectives, find out from those objectives what you want to ask, make sure that your presentation aligns with your objectives and also the questions that you're seeking to answer. And then, of course, your post-test should be relatively easy because you already have your pre-test. I don't really think that'll be an issue. But defining those questions are important. So if you come up with, how many questions are you thinking about?
I don't really know, actually.
Okay. So we'll say 10. And I'm trying to imagine all the questions you might ask. Typically what I do is, as I'm going through and developing a PowerPoint, I start thinking of questions that I might ask and, to other people, and I start writing them down in the PowerPoint. And, I might put them at the beginning as a pretest, if you will. And in the pretest, asking them specific questions about, what are the requirements to, what you have to ask them, what are your goals for the future? And like you said, what are your goals? And, list out some typical that you might see. And again, degree-wise, where do you want to go degree-wise? And maybe another one to say, where do you want to go in your career? Meaning, in other words, separate the degree question from their actual goal of where they want to go in the profession. And the reason is because there'll probably disconnect between, well, I want to be a case manager. I'm not going to get a bachelor's degree. So you'll be able to draw some contrast between maybe what their educational goal is versus their professional goal.
Okay.
So you're on the right track with that. And again, I like the idea of saying, okay, if you know what the professional goal is, and how long, what's the time frame that you want to evaluate the time frame that it will take them to get there.
Okay.
Time frame. So that's third question around time. And then you have to construct a question about their ability to accomplish that. I'm not really sure how to go with that one just yet. But if you think about it, what could you ask them in the post-test? Has your, have you been able to discern what level of education you're going to need to achieve the goals that you established? And what is that? Bachelor's, associate, master's, doctorate, whatever. In other words, you would have to mirror the questions, but it couldn't be exactly the same. But you have to get those pretest questions done first. Does that help?
No, that does. For the proposed plan that they're going to draw out at the end, do I have to come up with some way to evaluate that? Because that's really just their life plan.
Well, that actually is an evaluation. It's just not what we would traditionally think of as an evaluation tool that we might use to grade somebody, or it's a self-evaluation is what it is. So phrase it in the form. So participants will self-evaluate their goals, their professional goals relative to their degree level or whatever, But self-assessment, whatever form you want to use, whether it's a narrative or a series of, I really think a narrative is better because you really get some reflection. So an evaluation, a reflective evaluation, where they basically write them out, because if they write them out, they're more likely to achieve them if they're selecting from a list.
Yeah.
And I know that I don't know if I've ever shared this with y'all, but I may have. So I talk a lot about this, but I've powerlifted for 40 years. And so when I start scheduling a meet, the first thing I do is look at the number of weeks I have, what are the weights I want to get to, and I write them down. Because in past years, when I didn't write down specifically what I wanted to hit, I did not hit my goals. So just the process of reflecting on where I want to be at that moment in time, I may not still get it, but I'm more likely to get it because I've already kind of physically written it down or typed it out or whatever. So the reflective evaluation, which is where they provide a narrative to evaluate where they are and where they want to go.
Yeah, I agree with that. I would definitely have them do a written plan, not a select from a list, but their own personalized plan.
Right, because if you can get them to do that, that's doing what? That is, you're going to the level of evaluation of creation, and that's where you want to go. All right, well, if that's all you have, Christy, get those questions or the, you're going to send me questions or survey or whatever you're going to send me, to send it to me, and we'll cover it at the beginning of next week, okay?
Yeah, I'll do that tomorrow.
Okay,
Okay, Dr. Croft.
all right, thank you a lot.